The key insight that I got from the Doctors Company closed claim study was that fully 10% of the claims involved a communication problem, either miscommunication or failure to communicate between the doctor and the staff or between the patient and the physician. As a result of the study, I presented these findings to my 6 partners, and we reviewed this with our 35 staff. We reviewed how our staff communicates with patients, how we communicate with patients, and even more importantly, how our staff communicates with us after they've talked to patients. Another change we implemented was to institutionalize communication between the patient and the staff and the surgeon. And as a result of that, we now have clear guidelines for how the surgeon will find out what the communication was, when it took place, and what the result of that communication was. After reviewing this communication, we realized that we had the capability of putting this into the electronic medical record, but it simply wasn't being used. We reviewed with the staff how to do that and how important it was to put every communication, every use of social media into that record and then sending it to the surgeon to read. An additional change that we made was to make sure that every phone call between a staff and a patient was immediately put into the electronic medical record, flagged, and brought to the attention of the surgeon. An increasing trend that I have noticed in reviewing claims is the use of social media for patients to communicate with staff. Unfortunately, this communication does not get forwarded to the physician, and when the claim is filed, the physician can be surprised how much communication went on and even decision-making that was out of their control. I think every plastic surgeon should review this study. This is invaluable information that's not available on the internet, and you should use it as a yardstick to look at your own practice. Any one of these claims could have been yours. How did you handle it differently, and how will you handle it differently in the future to keep from getting a claim in a similar manner?